quick read of this. It's all the things that I've just said. I'll not read through it, just pause the video, have a read of it, just to consolidate the things I just said. And then we'll move on to electrocardiogram. So, you probably know what electrocardiograms are already. If you've seen them on TV and whatnot, you may have had one. But basically what they do is they'll monitor the electrical activity of the heart. So we call them ECGs, sometimes they're called EKGs, usually in the US. Electrocardiogram or electrokyemograph, they call it over there. So what it measures is a small changes in electrical current that passes through the skin because of the depolarization of the heart. You know, there are slight changes in the electrical conductivity of your skin as a result. They're measured through electrodes that are basically stuck onto your body and your limbs, and they measure the potential difference across the whole of your body, and then obviously give you that familiar trace that I'm sure you've seen. So, looks something like that. Save me drawing it. Now, what you get, you've got the P wave here, which you can see. You've got what's called the QRS complex, and then the T wave. They're the bits that we need to know. They also measure intervals, so you can see there they're measuring the PR interval, the QT interval as well, and the QRS duration, because that can tell the surgeons or the physiologists, whatever, exactly what is going on with your heart. And basically, when your atria are depolarizing and contracting, so the SAN has sent out its impulse, you're going to get this, the P wave. Okay, that's basically the atria contracting. You've then got that time delay where the AVN holds onto it, and then it spreads down the bundle of His up the Purkinje fibres, and you get a massive contraction of the ventricles, obviously much more muscle mass there, so you get this QRS complex, okay, where the potential difference across them is changing because they're depolarizing and contracting. Following on from that, you then get the T wave, which is where the ventricles are relaxing. You've got ventricular diastole there, they're relaxing and they're going back to their normal charge. Okay, you do need to know these. You need to be able to label P, Q, R, S and T on there, and you do need to be able to say what is happening at each point too. Okay, this does come up quite a bit in the exams. What they can also ask you about are problems. So what we've got in here is fibrillation. So if you look at this one here, that's a fairly normal ECG. So P, Q, R, S, T, it all looks fairly normal there. Rhythmical, you can see, so dot, 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 you know, it's at a normal rhythm and everything looks normal. The one above it, well, there's something going on here. See all these waves, and you've got a missed QRS complex there, but it's all a bit strange. Now what's happening there is we've got what's called fibrillation. Fibrillation is where the contraction pattern of the heart's been disrupted. In this case, the ventricles are still contracting as they should be, you can see from the QRS, but the atria are not. The atria have lost their rhythm. So something's gone on there, probably with the SA node, that's disrupted it, and so it's just kind of twitching away the atria are. They're not contracting as they should do. So you'll not be delivering blood as effectively as you could do to the ventricles. The bottom is a different story altogether. So on the bottom, bad news altogether, there's no rhythm there. You can't see any rhythm, and so this is effectively what would happen in a heart attack. This is called fibrillation. So the whole of the heart has now lost its rhythm. It's all just contracting, hence you can see there's lots of different depolarizations, repolarizations, but just no rhythm at all. The heart's just twitching away, and it needs its rhythm back. Now, you've heard of defibrillators. A defibrillator stops fibrillation, so it stops this from happening. You send the charge through the person and hopefully it kicks back into that normal kind of rhythm. Hopefully, that's how they work. Once you flatline effectively, the heart stops contracting and you shouldn't really be able to restart it at that point. It's when it's in fibrillation that you can restart it. This is what happens as a result of a heart attack. So you did about coronary heart disease, cardiovascular disease in year 12. This is the result of a heart attack. So you've got maybe atherosclerosis blocking off a part of the heart, or an atheroma coming in and blocking the blood supply off, causing damage, and then this disruption of the pattern, so that the heart stops working. Obviously, if this is not stopped, then the patient dies. So pretty serious is fibrillation. A couple of other examples: arrhythmia. Well, arrhythmia is when it lacks rhythm. so it doesn't all contract at the right kind of time. So you can see this ECG in comparison to a normal one, it's not, it just isn't regular. See, it's just not a regular pattern. So that's arrhythmia. One of the worries, there's a link between arrhythmia and just sudden death. So you do hear on occasion about people just dropping down and their heart stops working. There is a link between arrhythmia and sudden death. So generally, people with arrhythmia do need to have work from surgeons and so on to see what's going on there. A couple more keywords. Bradycardia. Bradycardia is a slow heart rate. So it is less than 60 BPM. If your heart rate's less than 60 BPM and you're not a training athlete, then you've got bradycardia. What often happens is, well, so you're fainting, shortness of breath and so on. It can cause death if it's very, very severe. People tend to worry less about that, about bradycardia, than they would about tachycardia, but obviously it does come with its own dangers. Tachycardia is the opposite. It's a quick heart rate, so a heart rate that on average at rest is higher than 100. Leads to increased work because your heart's having to work harder, and therefore you need more oxygen to get to the heart in order to supply it with the energy that it needs, and ultimately the results of that are often heart attacks. So tachycardia and bradycardia, again, keywords have come up quite a bit. You need to be able to define them and talk about the possible consequences of each. Okay, that's about the lot. So things we're going to be looking at when you come into the lesson. Everyone, C grade and above, being able to define these terms for VO2 max, cardiac output, stroke volume, SAN, AVN and myogenic. Most of you for B grade, describing the normal electrical activity of the heart, how that brings about cardiac cycle. And then for A and A star, we're looking at relating those ECG traces I just showed you to the electrical activity of the heart, so seeing what happens at each part. There's a couple more videos I put on after this just to go through the control of cardiac cycle, and then a little bit about this A star part because it is quite tough. A little bit about this bit just to go through what ECGs look like and relate them ultimately to what's happening in the heart. So have a quick look at those, and that'll be it from me.
Action potentials originate in the sinoatrial node and travel across the wall of the atrium from the sinoatrial node to the atrioventricular node. Action potentials pass slowly through the atrioventricular node to give the atria time to contract. They then pass rapidly along the atrioventricular bundle, which extends from the atrioventricular node through the fibrous skeleton into the interventricular septum. The atrioventricular bundle divides into right and left bundle branches, and action potentials descend rapidly to the apex of each ventricle along the bundle branches. Action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. The rapid conduction from the atrioventricular bundle to the ends of the Purkinje fibers allows the ventricular muscle cells to contract in unison, providing a strong contraction.
This recording is known as an electrocardiogram, or ECG, sometimes referred to as an EKG. A tracing of the overall electrical activity of the heart, resulting from the propagation of many action potentials. Let's look at what happens during a single beat of the heart and how these events are depicted on an ECG. In a normal heart, each beat begins in the right atrium with an action potential signal from the sinoatrial or SA node, the heart's natural pacemaker. The signal spreads across both atria, causing the muscle cells to depolarize and contract, inducing a phase known as atrial systole. On the ECG, this atrial depolarization is represented by the P wave. The period of conduction that follows atrial systole and precedes the contraction of the ventricles is depicted on the ECG by the PR segment, a flat line following the P wave. When the signal leaves the atria, it enters the ventricles via the atrioventricular or AV node, located in the interatrial septum. It enters the bundle of His and spreads through the bundle branches and the large diameter Purkinje fibers along the ventricle walls. As the signal spreads through the ventricles, the contractile fibers depolarize and contract very rapidly, inducing ventricular systole. The ECG's QRS complex represents this rapid ventricular depolarization. Atrial repolarization also occurs at this time, but any atrial activity is hidden on the ECG by the QRS complex. Finally, as the signal passes out of the ventricles, the ventricular walls start to relax and recover, a state described as ventricular diastole. The dome-shaped T wave on the ECG marks this ventricular repolarization. On the ECG, the ST segment depicts the period when the ventricles are depolarized. The QT interval represents the time it takes for both depolarization and repolarization of the ventricles to occur. The sequence of events just described and the associated ECG trace repeats with every heartbeat. Remember, an ECG is not a tracing of a single action potential, but an amalgamation of the many action potentials that constitute the electrical activity of the heart.